All right, so some more reflections on the couple of regenerative medicine conferences that I've been to in the last month or so is image guidance. Image guidance for injection therapies is certainly not controversial at this point, but it is also not universal in the field. And I think this is a big problem in the year 2025. So what we have is ultrasound and fluoroscopy. Fluoroscopy is an X-ray technology that, while it is can be used for unique procedures, especially in the spine, 95+% of musculoskeletal injections can be done accurately and safely with an ultrasound. 100% of the injections and procedures that I do are ultrasound guided and can be done so safely. So fluoroscopy and ultrasound, for the purpose of this conversation, ultrasound, no radiation, in office, much simpler, and the vast majority of things from joints to tendons to ligaments can be done accurately and safely with an ultrasound. So the problem is, none of what I said is controversial, but there are still people in the field who, not only in the field, but like sort of thought of as leaders in the field, that still do not use image guidance for everything that they do. The problem with this is that, when we've done studies of very, very simple injections, like a subacromial injection under the bone in your shoulder here. It's super simple. It's very close to the skin. They've studied quote unquote experienced injectors doing this type of procedure, and experienced injectors doing just this simple injection here have an accuracy of about 80% when it's done blindly. Which, you look at 80%, like that's pretty high, but that's 1 out of 5 people that do not get the injection done correctly. And it's also 5 out of 5 people that the person doing the injection doesn't know if they did it correctly or not, because they don't get any visual feedback of whether it was placed correctly or not. And so what you hear even from speakers at these conferences is, so for example, there was a speaker who was talking about using ultrasound in the spine to look and mark the spine targets, to find them on the ultrasound, mark the skin all over the spine, and then puts the ultrasound away and then blindly injects based on the skin markings that he made with the ultrasound, right? That doesn't make any sense, right? That is just someone who's not, I would say, not confident enough in their ultrasound guided injections to do it with guidance, right? You're still injecting blindly, and you still can't see where the needle goes, and even if you think you know where it is, you don't know what you don't know, and you can't see if it's correct or you can't see if it's incorrect. And we're talking about spine now. I mean, this is a very simple injection, less than a centimeter below the skin, maybe a centimeter below the skin. Spine, we're talking about 3-4+ centimeters below the skin. There's just no way to know where you're at. And so the fact that this is not universal still is a problem. And what people will say who do this, or who don't use ultrasound guidance all the time, is, well, I've done 1,000 of these. My patients get good results. Just trust me. And what I say to that is, for you as a potential patient, do you want the person with a bunch of experience, like unvalidated experience in terms of like injection target precision, maybe at best at 85% accuracy? Or do you want someone who's done thousands of injections with 99.9% accuracy because they can see the needle the entire time? We can see the needle take the path to the target, go into the target, be at the target, inject, move along, and be as precise as possible. So for you as a patient, the question is simply, are you okay with someone saying, I've done this a bunch, just trust me? Or do you want someone who's saying, I have expertise in ultrasound guidance so that there isn't any doubt from a visual and anatomical perspective where the medicine that you are paying for is going, right? Again, let's be generous, 85% versus 99.9%, right? Which do you choose? Piggybacking off of this is, the RMSK certification that I have is really a distinguishing certification. It is not something that is easy to obtain. That's why only a handful of people in the state and maybe only a couple hundred in the whole country have it. It's not something that's just a part of MD training, right? I will be criticized by others in the field because I'm a naturopathic doctor for not having adequate training. But you can go through a sports medicine, be an MD and go through a sports medicine fellowship, or go through a physical medicine and rehabilitation fellowship and not be anywhere near ready to sit and pass an RMSK exam, because the ultrasound in most of those kind of programs is used sort of instrumentally, right? Like used, you kind of learn how to use it on the side, learn how to do a shoulder injection. Whereas with the RMSK, the level of detailed anatomy that I am versed in, the way that I'm injecting in terms of layer by layer, precise into the joint, into very small ligaments, right next to very small ligaments, the precision and the certainty is really the distinguishing factor that just because someone's a sports med doctor or some other related kind of specialty does not mean they know how to use an ultrasound adequately. And we see that again at these conferences where people are sort of doing a lot of hand waving, right? Even with cortisone, like I do cortisone injections, and I do all of those ultrasound guided because, again, I'm not happy with 80% accuracy, and nobody should be. Again, the year is 2025. You are paying out of pocket for most of these things where everything is uncertain, right? I don't bat 1,000, right? I can't help, and I don't help every single person that I see, right? I try my best, and I try to give people the best kind of prognosis possible. But what we can do is provide 100% certainty in the location where the medicine is placed, right? And so at least then, if you don't get better, we've sort of checked that off the list, and we can move on to other potential possibilities of pain. Whereas if you are injecting blindly, I don't care if you've done 1,000,000 injections, you don't know if the patient didn't get better because you missed or because you got in the right spot and it wasn't the right, pain generator or diagnosis. So, I think the takeaway for people looking at solutions for their pain is, if someone that you're considering getting injections from is sort of not fully versed in ultrasound or not using ultrasound to do your injection, I would say at this point in time in medicine, it's just completely unacceptable. Ultrasounds are accessible, they're in office, they're part of every visit that I do, and there's just no reason not to use them. So come see an expert and get exactly what you're paying for every time. Thanks.